A couple of nights ago, got up in the night as we old guys do, and I fell, as we old guys do. But I tripped and lost my balance and took a fall, and I crunched the side of my head, which is only a tiny little cut. I thought I'd have a black eye, but as you can see, I don't. But what happened was that I must have fallen badly. I don't know how I did it, but I really messed up my hand. And as I'm right-handed, that's a big inconvenience to me. So I'm looking at it, and it actually looks to me not a severe fracture, but it looked like it could be just a hairline fracture, which would cause some bruising. Now, I watched it, as I said, for a couple of days, and I decided, no, all I need to do is just keep massaging it, which I've been doing for a couple of days, and now it's doing fine. I still don't have the opposable thumb in yet. The thumb is bruised at the base. The reason that this is of any interest to anybody is only because of what my immediate reaction was based on my recent experience of the medical facilities that are available to us, not just in the province. It can't be written off as being something, well, you're out in the middle of nowhere in the boondocks, so what do you expect? Do you think that there's going to be a five-star hotel style hospital where you are? No. Well, no, I don't actually. It's something that I don't really think about. So what are we really talking about? We're talking about the state of what is available to us medically since the COVID fiasco started. I started redoing my house and called it the quarantine madness. And that's really how I feel. It's very unpopular to be this way, but what is increasingly happening nowadays is that as more people come to the fore and tell of their experiences, it's becoming more and more real. So what do I know about the way that things work here in this area, in my part of the hood? We have a small hospital in Taliban, and I guess they do the best they can under normal circumstances, but I don't believe that we're in normal circumstances, because what's happening now is that when you go to the emergency room, they won't even look at you unless you have a COVID test. Now, they don't test you for cancer, they don't test you for any one of 100 maladies that could or may not strike you. They just want to test you for COVID. And the reason for that, based on my experience, is that they get paid for that. So even hospitals, government hospitals, are still run on money, and they go for money. Now, earlier, last couple of years, last 3 years say, we've supported people who are burying a loved one. One of our previous helpers, her baby died. Testing on that was prior to COVID, so can't really blame that on the situation. But back then, limited facilities, and we helped to bury that child. Then the mother of one of our students died. Now, she died in isolation because she was deemed to have been infected with the COVID. But in actual fact, she had a heart condition, but it still went down to that. How do I know that? Now, here's my take on it. What happened was that the family were given an out of jail or pass on jail ticket. It was put to them that if the hospital were able to put down with their agreement that the mother had died of COVID or was COVID related, then there would be no charge for the hospital. Now imagine somebody living in an EPA house or on a dirt floor, and any of this kind of situation, which is very familiar to the poor in the Philippines. Here's what we're offering: free hospitalization if you just say what we want you to say. Well, of course they did. And then we had another case where they also were asked the same thing. Now, the kid that we lost, that was the sister of Lovely, was LJ. Now, LJ was given free hospitalization, got to get that one right, and she got out. She had to be put into a bag. We buried her at 10 o'clock or 11 o'clock at night because of the dangers of infection of COVID. All of that has been apparently dropped now. But how is the aftermath of this impacting the way that we think about our healthcare? Beth herself was not feeling so good, and in a situation where she would normally have gone to the ER, been admitted into the ER, put on a saline drip, because mostly when people go in here in the Philippines, one thing that they have in common is that they're dehydrated. So she goes in, but this time they want to give her a swab test, which in my humble opinion is an invasive medical treatment, because that thing is about this long. Look at it next to my face. It's this long, and it goes right up your hooter, I can tell you. And does what? The inventor of the PCP test has actually come out and said that it's not really being used for what it was, and it doesn't work on that anyway, because if they ramp up the sensitivity, for the want of a better word, if they ramp that up from the 20 or 25 units which is recommended, they can put it up to 35, 40 or 45, and boy, they'll find something on an aspidestra that would make it seem as if they were, what they're looking for, infected with COVID. So everything then will be COVID related. We said no. We were criticised for this. Oh, somebody, one of our passing viewers, not a subscriber, a passing viewer said, oh, so you're now a medical professional, are you? No, I'm not. But anybody who is given the information necessary to make an educated permission for consenting to any kind of treatment, you know, as an example, if you go in and you are diagnosed as having cancer, they're going to tell you what you're going to say to the doctor. So what's the choices? It's going to say, well, what we would normally do is we would give you a therapy which is going to burn everything. So they go in, and it's very much known that the medicine that they talk about for, say, cancer, is that they're going to burn everything, hoping that the bit that they burn, which is supposed to be left there, is going to be able to survive, and so will you. And they may give you a 30% better chance of surviving for longer. But you are able to make give an informed consent. You're able to look at what are the chances. So in that particular case, you would say, so what's the chances? What do I have? What do I have in terms of how long? And the doctor may say, well, maybe 6 or 9 months. And if I take this therapy that you are offering me, what will that give me? 6 or 9 months, or maybe 12 months. And then you would ask, if you had any idea at all, you'd ask, well, what would the quality of life be for that time? And that's where you would start to make your informed guess at whether you are prepared to do what's needed. Now, when we took Beth in, they said, well, first thing, you have to take the swab test. Why would we do that when there are no symptoms? Well, it's a protocol. Now, we said no, and when the doctor came out, eventually, after we'd been there maybe an hour, the doctor came out and he talked to Beth about how she felt, and he had already been told that we had refused the PCP test, and so he said, yeah, I understand. Now, what I suggest is go back to your doctor, and he can prescribe some medication which will probably handle everything that you're going through right now. So that was it. He was quite calm. He apparently understood, but that's what it took. And up to that point, we were still in the outside tent, which was passing for the pre-ER situation, right? Now, when I had a fall, let's face it, let's be realistic. I'm 84 next birthday. So, falling is part of getting older, I can tell you, because your balance gets affected. Now, I'm doing really well. I'm very, very lucky to enjoy the kind of health that I do, and fitness. I am extremely fortunate, and I'm grateful for that. But I had a little accident, and I fell and knocked my head, and normally I would probably have gone to the ER and I'd have had an x-ray at least on my hand. So now if you look at both hands, the flexibility in my injured hand is not what it should be. Now, when I mentioned this to a subscriber, Hardcore John in the UK, he said, well, you go in, and normal thing will be to go in, have an x-ray, have a look at what is happening in the hand, and hopefully it's just a sprain. Or, as I had put to him, it's whoops, got to go into four-wheel drive. It might be just a hairline fracture. Well, a hairline fracture will produce some bruising, but as long as you keep the thing moving, then you're going to be okay. Bearing in mind that before this, I don't know, 3 or 4 years ago, I fell while I was working on the house, and I broke my collarbone. Now, I could have gone to hospital for that. It's here. I can still feel the break. What would they do? Well, the old way was to strap you up and keep it immobilized. I went to a therapist, massage therapist, an old lady, and when we got there, Beth was taking off this elastic bandage that in good faith I had said, well, we'd better get this immobilized and strap me up. And she watched this coming off and she didn't say anything. And then she massaged me. She was brutal, and she said, yes, he has a break to the collarbone. And then she watches as Beth starts to strap me up again, and she says to Beth, "Why are you doing that?" And Beth said, "Well, isn't this how you treat a collarbone fracture?" And the old lady said, "No, don't do that. Exercise it." I didn't believe them until wasn't sure about that, but we walked about 200 yards to where a friend of ours, Brian, an Australian, said she's right. You know, that with a good therapist and doing the right exercise, the Aussie footballers, when they get a common break, which is actually common, is the collarbone, said, you know, they can be back on the field within weeks. So I used to do the exercise, I rested, and I did the exercises, and well, I self-medicated, didn't I? I didn't take any painkillers because I didn't need to, and so I'm fine. So that's what I'm doing here, and already the flexibility and the strength is returning. But my attitude is what I'm trying to get, is that this is how people in the Philippines feel. And you know, once you have an experience on it, you can't blame them for this, that they view the hospital in a different kind of way. They're quite prepared to go down and go into the emergency room, where they'll be put onto a bed, hooked up to a saline drip. I think that's what they do for dehydration, and they'll lie there for a little while and get hydrated, and then they might be given a prescription for something or other, because usually Filipinas complain when they have a fever. Fever is one of those Philippine mysteries that I'll never ever understand, and suspect that many foreigners feel the same way. So I could have gone down, and normally as a foreigner, normally I would have done what my friend John said. I'd have gone down to the ER, and for something like a hand, I'd have been given an x-ray, and then if they said, well, it's a break, then they would have worked out how to get the bones back in place, and then they'd have put a cast on it, and I'd have had that for God knows how long, what, a month or 6 weeks or something before they took that off. So things have changed, and they've changed in a way which has us behaving according to a protocol set by someone who is not working in our favor. If I go in with an injured hand and a scratch on my eyebrow, I don't have any respiratory symptoms, and I shouldn't be given a test. And yet I knew that if I did go to hospital, that's what I would be subjected to, would be an argument about why I didn't want to be tested for something for which I had no symptoms. Now, just to back up what I'm saying, we've had a visitor very recently from abroad who has come over, and while he was here, he suffered some kind of an episode, shall we say, where on the left side, which is indicative of a stroke, under normal circumstances, his left eye went a bit wonky, and he went to the hospital. He was in there several hours before he finally saw a doctor. He said no questions were asked about my eyes, but I was starting to be given tests, and the first test, of course, is a COVID test, which he mentioned, well, I don't have any symptoms for COVID, I don't think I have a COVID, why am I being tested for COVID? Well, it's the protocol. You see what I mean? We're being ruled by these protocols which have their own agenda, and that agenda is not to help cure patients. because they're testing for something despite the absence of any symptoms. Where is that coming from? Going to? So things are changing, and we need to stand up. You know, after a while, being a good boy and not saying anything really doesn't work. And you need to know that. And you need to know that it's a precursor for other things to come. My friend, the visitor from abroad, went through quite a bit of trauma in the hospital before finally telling the doctors, I need to get out. So they wanted him to take a second, and I think perhaps even a third test. Finally, once he got out, he actually did, I'm not even sure whether they tried to say that what he had been in there for was COVID related, because they admitted that finally somebody, because he blew his top and did an ugly foreigner kind of reaction, they finally did something that would try to find out what had happened with his eye, and they actually said at first that it was stroke related, and later I think that they backtracked on that as well. So he got out, he went to see the barangay captain, and the barangay gave him clearance to leave for where he had been staying, so that he could get on a plane. And apparently, because he has been vaccinated prior to coming, they're actually talking that everything is okay for him to be able to go home and get back into the States. Our medical health and efficiency has been lost somewhere along the way, and that's for sure.